Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us today. In studio, we've got Dr. Chris Alden, an orthopedic surgeon, joining us to talk about how more orthopedic and rehabilitation specialists are utilizing some very innovative therapies and therapeutic biologics to restore functionality in the body. And after he gives us a little bit of a background about himself, we'll jump right into some of this innovative technology. Welcome to the program, Dr. Alden. How are you?
I'm good. Thanks for having me.
Great. Is orthopedic surgery something that you've always been involved in since you went into med school, or something that kind of evolved out of your experiences in learning?
It's sort of funny you ask that. I think most orthopedic surgeons fall into two categories. Basically, one that they know they want to be an orthopedic surgeon by the time they're in high school or junior high or whatever, and then there's people like me that know absolutely nothing about it, and actually I didn't figure it out until my last year of med school that that's what I wanted to do, and I was exposed to it as a rotation and found it to be really fun. Something I love to do. I believe life is about mobility, and that's why I love doing what I do.
So in your practice, what would you say are some of the most common injuries or maybe conditions that you run into?
Well, a majority of my practice basically involves the treatment of hip and knee arthritis. I would probably say 95% of my patients come in with, they're generally a little bit older, usually, 40s, 50s, 60s and above, and the vast majority of them come in for the treatment of, a degenerative condition of the hip or the knee. That's what I've kind of put myself out there as, that's sort of the specialty, and treatment, the treatment of arthritis is sort of what I've, sort of specialized in over the last 10 years, basically.
So traditionally, what are the most common ways that you treat, say, arthritis, or some of the most common things that come your way?
Well, we always try to start with the easy stuff, things like physical therapy, over-the-counter, safe, non-narcotic, non-addicting type pain medications. Mm-hmm. And then we can involve into, things like physical therapy, and then injections, and then ultimately, surgery, which of course is always a last resort for the treatment of arthritis. But, that's one way we can solve it, would be a joint replacement type procedure.
Now, you do employ some of the traditional methods, but you've also joined us today to talk about some new innovations.
Well, I have used injections. Obviously, I think every orthopedic surgeon does over the course of your career. Those types of injections can evolve. We used to basically 100% do steroids, but we find that there can be some side effects associated with them. And then visco supplementation is another type of injection that we commonly employ. But, I learned about AmnioFix probably about 3 years ago, and kind of, was sort of intrigued by the possibility of, what it can do, and started about 2.5 years ago, using it in select patients, and then slowly I've expanded that indication, and we've had outstanding results in the treatment of hip and knee, as well as shoulder problems, not just arthritis, but also tendonitis and bursitis. So it's been a great adjunct to, my armamentarium to treat, hip and knee problems and arthritic conditions.
Now, just to be clear, AmnioFix is an injectable itself, or is it different from an injectable, or different from other injectables?
It's different. Basically, it's amniotic, tissue that we reconstitute into a liquid form, and it's basically an injection of, growth factors and proteins that can help stimulate the recruitment of stem cells, mesenchymal stem cells that circulate in the body, and they can go to the site of the injection to promote healing and regeneration.
Are these the patient's own stem cells, or are they stem cells that come from another source?
The tissue is derived from women who deliver a baby. It's a planned C-section. They're donors. They're screened very tightly and very closely. And the amniotic tissue is then, obviously processed and sterilized, and then we reconstitute it in clinic. So it's not necessarily the patient's own stem cells, but it can attract, those molecules, those proteins and growth factors can attract the patient's stem cells to go to the site, whether it's the hip, knee, or shoulder. So
it's basically a stimulation of the patient's own powers, right?
Correct. It's sort of an easy way to get the patient's stem cells to the site. There's a lot of misinformation about stem cells out in the, internet. And, when we talk about it with patients, I tell them the only way to really get your stem cells, would be to go in and do, a bone marrow aspiration or harvest and recruit the stem cells out of that, bone marrow, grow them, and then re-inject them. And that obviously is a very involved, complicated, difficult process and expensive. So I basically tell them this is a inexpensive way to, recruit stem cells. They basically, the proteins and growth factors that we inject are, they act as like a magnet for stem cells to go to the, site and the joint and hopefully repair and regenerate tissue.
Now, you say you've been aware of AmnioFix for about 3 years or so. In your experience, what types of drawbacks or maybe some negative side effects have you encountered, and how can those be avoided and or eliminated?
Well, as far as like drawbacks, I would say the major drawback would be that it doesn't work. And that's really honestly a very small subset of patients. We've been tracking everybody very closely, and it's probably 15 to 20% of patients don't get that substantial benefit that we see. That's the main, I would say if there's a negative, that would be it. There is some pain at the site of the injection, and we think that is a sort of pro-inflammatory response that may be a part of the process. So I tell patients, I warn them, your knee or shoulder or hip is going to be sore for, anywhere from a day to 3 days. And, but as far as like drawbacks, we haven't seen any adverse reactions or any problems related to the injections themselves.
Now, that being said, in wrapping up, why, in your opinion, do you think that the non-surgical and non-opioid treatment options for your patients benefit both the medical practice and the patients' lives?
Well, I think the main benefit that we see is that there's, we're always looking for something that's going to help patients achieve better function and mobility, in a non-surgical, safe, low-cost environment. And I think AmnioFix solves that. It basically gives us the ability to, get patients better with a simple injection. Perhaps these patients have failed other injection modalities and they're looking at, surgery. If we can offer them something that's going to either delay or, prevent the need for that arthroplasty type procedure, then it's a huge win for patients.
Well, where could we learn some more online about AmnioFix?
I think they actually have a really good website, AmnioFix MiMedx. If you Google that, you'll find their website, which has got a lot of great information about the injections and the treatment options.
Well, Dr. Alden, thank you so much. Hoping you'll come back with us.
Absolutely. Thank you. Thank you, Neil.
All right.
Great. Wonderful. Thanks so much.
You've been listening to HPR.FM, Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of the programs are available at healthprofessionalradio.com.au and also at HPR.FM. You can also subscribe to our podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at HPR.FM and healthprofessionalradio.com.au.